How do global health disparities affect bioethics? Have you ever thought about how health outcomes can vary so much around the world? Global health disparities refer to the differences in health outcomes and access to health care among different populations. These disparities raise important questions about bioethics, which is the study of ethical issues in healthcare and life sciences. Let's break down how these disparities impact key ethical principles in medicine. First, consider the principle of justice. This principle demands that healthcare benefits and burdens be distributed fairly. However, billions of people around the world lack access to basic healthcare services. Meanwhile, others enjoy advanced medical technologies. This situation raises ethical questions about how we allocate healthcare resources globally. Are we perpetuating unfair inequalities? Next, we have the principle of equity. Equity means providing healthcare based on need rather than factors like income or location. Unfortunately, many low-income countries face barriers such as poverty and lack of infrastructure. These obstacles lead to worse health outcomes for marginalized groups. This inequity goes against the ethical obligation to reduce suffering and promote health for everyone. Another important principle is respect for persons. When global health disparities lead to preventable illnesses and deaths, it challenges our recognition of human dignity. Certain populations are systematically disadvantaged in health, which reflects a failure to acknowledge their equal rights to health and well-being. Then we have beneficence, which is the obligation to do good and prevent harm. However, global health disparities arise from complex social, economic, and political factors that healthcare providers cannot always control. Bioethics must consider these broader determinants of health, such as education and environmental conditions, which significantly influence health outcomes. Practically speaking, these ethical challenges push bioethicists to look beyond traditional clinical ethics. They need to address global health inequities through policy advocacy and interdisciplinary collaboration. For instance, ethical frameworks now focus on benefit sharing. This means ensuring that advancements in medicine and research also reach disadvantaged populations. Additionally, investing in global emergency preparedness is essential. This helps protect vulnerable groups during crises, such as pandemics. By addressing these ethical concerns, we can work toward a more equitable healthcare system. In summary, global health disparities highlight significant ethical challenges in achieving fairness and respect for human dignity in healthcare. Bioethics must broaden its focus to include social justice and global health equity. This approach will guide policies and practices aimed at reducing disparities and upholding essential medical ethics principles.